Hi, I'm Dr. Charles Bouckley, and thanks for tuning back into the Wyoming Vein Specialist and Casper Medical Imaging YouTube channel. So last time we had a broad brushstroke discussion about what different treatment modalities might be appropriate for you in your individualized patient treatment protocol. From least invasive, we have no treatment at all, meaning you have little teeny tiny reddish blue veins that are cosmetic only. They're not causing you any pain. They may cause you some cosmetic distress, and those are treatable by a laser light therapy or by a short injection treatment of sclerotherapy agent. Those are not typically the veins that are going to cause you symptoms like heaviness, ache, pain, and swelling. When we move more into the larger symptomatology of ache, pain, and swelling, or large blue bulging varicose veins, we get into some of the more invasive procedures. Now, many of the third-party payers and insurance carriers want you to wear a pair of these lovely compression socks for a period of 30, 60, or even 90 days. Now, the way that a pair of elastic compression socks work is they're tighter than your normal cotton sock. And because of that, what they do is they create pressure around the calf, and they make these of all sizes from the calf all the way up to pantyhose length. They create pressure around the calf that closes or tries to close the superficial venous vasculature. What does that mean? All those big bulging blue veins on the lower extremities are pushed together because of the elastic nature. And these come in many different graded compression from 20 to 30 all the way up to 50 to 60 for patients who have really severe disease. There are inelastic compression devices, classically called Uniboots, but those aren't typical for patients in the blue, bulging, and painful subsegment of venous varicose disease. Those are better for patients who actually have venous ulcerations. So compression therapy is one modality we can use. If we've worn these for a period of time and you have failed therapy, we all know that this is a temporizing measure. Compression socks don't fix the underlying problem, as we talked about last time. When one of the saphenous veins fails and the blood falls with gravity and then fills the veins down below, that's what causes the pain and pressure. So obviously, as soon as you take off the compression hose, you no longer have that resistance mechanism to keep that superficial venous vasculature closed. So the second methodology, and pretty much the workhorse of lower extremity venous disease, is laser therapy. Now, there are a whole bunch of different types of catheters, which are like long drinking straws that are usually used through a small needle puncture in the skin through which a wire is then threaded into the vein under direct ultrasound guidance. And in a later video, I will show you an example of how that works. The wires that we use are extremely tiny, and the vast majority of patients cannot feel these wires. As you can see, it's almost the size of a couple hairs put together. So once that wire is in place and the drinking straw, the catheter, is then placed inside of that vein, we create what's called a tumescent anesthesia around the vein. So if you imagine that my hand is the vein and the catheter is sitting within the vein holding the laser fiber, we create a halo of safety by injecting numbing medicine around the catheter and vein complex so that they're squished together like this. And what it looks like on the inside would be the catheter and the laser fiber sit inside the vein, which are pushed together by that halo of safety, that tumescent anesthesia. Once the laser fiber is turned on, it heat treats the inside of the vein, causing damage to the inside of the vein called the endothelium. That complex is then removed from the vein completely, and then compression hoses are placed on the lower extremity that was treated. That thermal ablation of the vein and then the 2-week compression thereafter are what allow the healing process to seal that vein shut. And it's just like a waterfall. If you put the dam at the top of the waterfall can no longer flow. If you heat seal the vein shut, then the blood can no longer fall with gravity in the wrong direction. A common question that we field with respect to venous closure devices or different types of ablations is, what happens to the blood flow? Where does it go? A great analogy for the lower extremity venous vasculature is a ladder. And if you think about two legs on the ladder, one being the superficial and one being the deep, and they talk to each other through what are called perforating veins, those are the steps on the ladder. Just imagine that we have all these steps on the ladder and the superficial system has been spot welded shut. Those veins, those steps on the ladder, the perforating veins, take the superficial venous blood and they redirect it down into the deep system. The muscle then squeezes the deep system and it pushes the blood back up towards the pelvis and the heart in the direction it's supposed to go. So that superficial vein that was broken now can no longer flow, but that in and of itself is not harmful for you. And as a matter of fact, that's precisely what the underlying treatment requires. Please feel free to call us at 307-232-5054 and schedule your consultation. Remember, we'll walk with you until your legs are healthy again.